In the last 20 years, the number of people diagnosed with diabetes has more than doubled. The CDC says about 38 million adults in the U.S. have this illness and disease. Type 2 accounts for about 90 to 95% of all cases. Marty Salt puts your family first and explains some of the surpassing things that could be contributing to the increase.
Common risk factors for type 2 diabetes include obesity, family history, and age.
Aging is one of the biggest risk factor for most of the chronic diseases.
Sugary drinks and processed foods are also linked to type 2 diabetes. But experts say it's not only what you eat, but when you eat. A study published in Nutrition and Diabetes found people who eat 45% or more of their daily calorie intake after 5 p.m. had lower glucose tolerance. Over time, that can negatively impact metabolism and BMI.
The gut influences very heavily our whole body physiology.
Skipping breakfast 4 to 5 days a week is linked with a 55% increased risk of type 2 diabetes. The Journal of Nutrition says not eating a morning meal can impact blood glucose levels. It can also increase eating later in the day.
If you don't eat, your body conserves and says, I need energy, where is the energy? And it can lower your metabolism.
Poor sleep is also strongly linked to type 2 diabetes. According to National Institutes of Health, sleep is essential to control hormones, including several connected to glucose metabolism. Helping you avoid harmful habits for your health. Marty Salt, WGEM News.
And also, the NIH says that women who deliver a baby weighing at least 9 pounds have a 20% higher chance of developing diabetes later in life.